Good afternoon, everyone, to the attendees in East Africa, and good morning to the ones in Central Africa, and good evening to Professor Bennett and participants in Australia and New Zealand. Welcome to our Fireside chat. Today is going to be a series 177. My name is Dr. Yuri, and I'll be the moderator for this session. So today we'll be having quite an interesting topic on dialysis exercise, physical activity and laughter. And we're going to look at some case-based insights. Our guest speaker for today is Professor Paul Bennet. And he's a kidney care nurse, a researcher, and an educator. He's an adjunct professor at Griffith University under the University of South Australia. Professor Paul has worked in the US and Australia, focusing on pragmatic clinical research strategies to improve the quality of life of people with kidney disease. Most recently, he co-chaired the 2023 KDIGO Nursing Management of Dialysis Symptoms meeting and was the lead author of the 2023 International Society of Peritoneal Dialysis Exercise Practice Recommendations. He heads up the Global Renal Exercise, GREX network, a group of international clinicians, patients, and researchers dedicated to keeping people with kidney disease active. So looking forward to the topic of the day. And maybe Professor Bennett will confirm whether laughter is truly the best medicine today. Over to you, Professor Bennett. Thank you.
Thank you very much. Thank you for the nice warm welcome. I'm a bit disappointed it took 177 fireside chats to get to me, Dr. Yuri, but that's okay. I'll get over it. As we've talked about, the title is today, the dialysis exercise, physical activity, and laughter. And I will talk about the laughter in a minute, case-based insights. I put case-based in inverted commas because I don't like talking too much about cases. I like talking about people. And so this is all about people and people who are like you and us, except those people less fortunate than us with kidney disease. Now, I met this fellow, Lloyd Vincent, at a dialysis symptoms meeting in Berlin last year. And he was a pretty out there guy. And I thought, who's this fellow running these African healthcare clinics, and got to know him quite well. And the reason why I put this up is because exercise and activity has got a lot to do with symptoms, and that's really why I was at this meeting, because of the interest in trying to increase people moving, and hence you're listening to me right now. But after hearing what Lloyd and his colleagues at several successive meetings, it's amazing what everyone and all of you guys do. So I'm very impressed. And we can always learn from each other, that's for sure. We can learn from Africa, Africa can learn from Australia. So here's our first case, or our first person. So Edgar was a fellow who was on dialysis for 5 years. He was pretty depressed, couldn't move around too much, and walked around with a stick. He's glomerulonephritis. He's had quite a few different members of his family also who'd been on dialysis. He wasn't able to have a transplant because he'd had cancer. So he was, clearly not in a really good physical state. But after 3 months of having an exercise physiologist and going through rehabilitation, this was Edgar. That's 3 months. He actually looks like a different guy. And this is what exercise programs can do. It won't do it for everyone, but it can do it for some. So the objective today basically is to provide knowledge, skills, and competence and tools to help people maybe in Africa and in your part of the world with kidney disease move more. And the last 2 words is really what it's all about. It's about moving more. And I don't think there's anything, there's no point in keeping people alive on dialysis with kidney disease if they can't live a decent life. And living a decent life is having good mental health, good physical health, and getting rid of their waste and keeping their fluid down. As Dr. Yuri said, I'm a kidney nurse. I've worked in both Australia and the USA, and so most of my experience has come from there. You probably know that dialysis in the USA is a little bit different than dialysis in most parts of the world. Dialysis in the USA may be better with this fellow in charge, but may or may not be. It's a profit-making system, unlike any other place. And what strikes people as well is that we had in America, we had these like fire programs, and we had a program where we needed to know what happened if someone with a gun was in our dialysis clinic. So it's a very different place to Australia. So that sign down the bottom is a sign that's in every room, and if there's a shooter or a person with a gun who's shooting in your US dialysis clinic, you have to write down how many people are in this room and if there's anybody wounded, and you put that sign onto the window so the people, the emergency services, can see the outside. That's hopefully we never have to use those. Kidney care in Australia is a little bit different. We have universal healthcare, so everyone gets healthcare. Everyone gets dialysis, whether you've got private insurance or public insurance, if you're within a certain criteria. We have a third of our patients are on peritoneal dialysis, so that's most of you would be familiar with that, where we have a peritoneal Tinkoff catheter and the semi-permeable membrane around the peritoneum acts as the dialyzer. We have quite a high success rate with kidney transplants as well, and of course we have programs where people who don't go on dialysis, we support them with symptom management as well, and we call that supportive care. So a little bit about you. This is just to see if you're awake. So in the chat box, I wonder if you could just quickly write your role, whether you're a nurse, nephrologist, dietitian, and what town or city you live in. A good presenter always needs to know their audience. I'll give you just a couple of seconds to do that. So I'm Paul from Adelaide, Australia. Nurse Nadola, thank you. Thank you very much. We won't bear with you, but it's good to know that we have lots of nurses involved, and because of course we know that nurses are the most important people in the kidney world, apart from the patients. Okay, so why do we accept physical function? This is a common thing that we see, and I'm sure that you see as well. A patient comes in on the first day of dialysis, they're probably feeling pretty sick. They're fluid overloaded, they might have a catheter in, and they're really anxious and nervous about this dialysis thing. They've never had it before, but after the first few dialyses, we get a bit of fluid off, they feel better. They might be less fatigued, less urea, and they're feeling okay. But over a period of 5, 10 years, however long someone's on dialysis, they physically deteriorate a lot quicker than what someone who didn't have kidney disease would physically deteriorate, and they end up getting, basically unable to move around. I'd like you to concentrate on the black bands here on this graph. So they represent the percentage of inactive people in certain stages of kidney disease. So on the left-hand side, say CKD stage 1, that black band represents about 40% of people who are inactive. As you move to the right, we see through CKD stage 3, you get about 60 or 2/3 of people who are inactive. CKD stage 4 to 5, where you get 3/4. Once someone's on hemodialysis, about 80% of patients are inactive. And over to the right-hand side, once they get a kidney transplant or a renal transplant recipient, they're the RTRs, they're active again. So because 40% of them are active. So the good thing about it is that people who are on CK stage 5, hemodialysis or peritoneal dialysis, who get a transplant can return to pretty much normal activity that they did beforehand. And we know that this decreased activity actually gets worse and worse as you get older. So that top line is non-dialysis people, the bottom line is dialysis people, and the bottom line is age. And as you get older, that gap between the non-dialysis and the dialysis activity, so these are steps, will get wider. And we know that more active people who are on kidney care, we know that if you're more active, you will less likely to die. Each of those step downs on both the black line and the dotted line represent a death. And so the top black line are people who do over 4,000 steps per day, and the dotted line below is less than 4,000 steps. And you can see you get far more deaths in that curve. When we compare the people who with end-stage renal disease who are on dialysis with many other people with chronic conditions, we note that people with end-stage renal dialysis, when measured in the physical function domain of SF36, which is a quality of life measure, we notice that they scored the worst of any chronic disease. So if the red bordered column is -8 in the physical domain when compared to normal. If you have limited use of arms or legs, so therefore if you're an amputee, you have a better active lifestyle. You have more activity and physical function if you have chronic heart failure, angina, diabetes, chronic lung disease, arthritis. It goes on and on and on. So our people who are on dialysis are one of the least active people. Why is this? Well, they're older often. They're on dialysis, so they have to sit down, and they've got this dialysis and this uremia, the CKD uremia, the fatigue and all of those sorts of things. But certainly from a pathophysiological basis, they have an increased risk of diabetes, high blood pressure, depression, insulin resistance, increases the inflammatory oxidative stress. On a functional side of things, you'll notice that people who are on dialysis, they decrease their fitness, their muscles get smaller, their physical performance gets smaller, and they have more disability. And this all leads to an increased mortality and morbidity. Now, exercise isn't the panacea for everything, but it certainly can help in some of these areas where if we do some activity, whether it be physical activity or program of exercise, then we can potentially block some of these pathways. We're busy people, so what can we really do about it? We can encourage physical activity, and I'll be mainly talking about exercise tonight or today, but physical activity can be art classes, it can be cooking, it can be Zumba, it can be laughter with yourself moving, it can be using those TheraBands that the man is down on the right hand side, it can be weights, it can be aerobics, it can be using stationary bikes. It's activity on dialysis, it's activity off dialysis. Again, it's about moving more, and that's really what we're about. I'd just like to introduce you to one group that Dr. Yuri mentioned at the beginning. So we have this GREX group, so Global Renal Exercise, and it's a bunch of over 450 members now from around 40 countries. And you'll see that most of our members are from Asia, Europe, South America, North America, and Australia. And it's this grey bit in the middle here. And so fortuitously, I happen to be speaking to people in that grey area in the middle. So we haven't really been able to, I suppose, market ourselves in Africa and be able to. So what this GREX group does is it's just a free group of people who are interested in exercise. So if you are interested in exercise, physical activity, and want to know more about it, we have newsletters, we have webinars, then by all means, there's that. If you take a photo of that website down there, grexercise.arizona.edu, join/GREX. It's free. There's no commitment there, but it would be great to see some of you guys from some of the different countries and have the capacity to receive some of our GREX products. So we have things like you can download these posters, physical activity exercise for non-dialysis CKD, and print them out yourselves. There's no problems. We just we just want people to be aware of what's around. This is a exercise for hemodialysis poster that you can download. This is an exercise for kidney transplantation that you can download. Generic sort of stuff. Yes, they're in English. We do have some in Spanish as well. We also have a GREX CKT exercise certification program. It's available for nurses, exercise specialists, nephrologists, dietitians, technicians, social workers. That's us in our first meeting in Calgary a couple of years ago. And what this exercise program is, where the website is there as well, if you want to take a picture of that. It's 9 modules where we have different bits of global renal exercise information, and you do a course and you can get a certificate from that course, and that's available right now. One of the largest studies that we've done recently from the GREX group was the exercise during hemodialysis patients with chronic kidney failure. It was published in the New England Journal of Medicine Evidence last year. And we had 471 people in the control group who didn't exercise, and we compared them with 446 people in the exercise group. And not surprisingly, we improved both the sit to stand and the timed up and go performance. These are 2 functional performance, commonly used functional performance measures. The 30-second sit stand simply is how many times you can sit to stand with your arms crossed from that chair in 30 seconds. I won't get you to do it now. It's maybe a bit silly. And the other one is see how fast you can go around that, which is from that seat. And then, so we had certain improvements in both of those things. Now, the important thing about the sit to stand is that you're using these big leg muscles and bottom muscles, and they're really important for just getting up out of a chair. And most of us have to do that once or twice. And particularly those people who are on hemodialysis, if you're sitting on a chair, you have to do that quite often. So someone like Jeff, who's our second person who I want to introduce you to, Jeff was, here's a lovely fellow, but was really deteriorating. He couldn't really do much around the house even, and he was getting pretty sad about all of this, and he was really reliant on this frame. And this is him in the waiting area. After 4 months of exercise, he could do 20 sit to stands in 30 seconds. His life was changed. But it took us to help him to rehabilitate. He couldn't do it by himself. He needed some expertise. So what's worked and what hasn't worked around the world? Well, basically, if it gets people moving more, it has worked. And I'll just show you some examples of that. I think one of the most important things too, it doesn't really matter whether it's anaerobic or aerobic. Certainly, if we go to the gym or if we want to do a run or something, we'll do what we want to do. What's really important is that when you're looking at anaerobic, so the guy on the left-hand side, he's on dialysis, and he's got a weights machine that he's pushing his feet against. That's really good for building up strength, but it also actually has an aerobic element as well. Similar to if you've got a bike, like the guy on the right-hand side, if you're doing a bicycle while you're during dialysis, that has mainly aerobic, but also anaerobic. So they're never really separate. You always got a bit of one in the other. I'm not sure if this video is coming through very well, but these are people in Mexico, very simple ankle weights. Dr. Yuri, I wonder if you can tell me whether you can see that or not.
Yes, it's visible.
It's visible, but probably not going too quickly. That's okay. And this is another one. This is a dietitian in one of our Mexican dialysis clinics, and she's helping someone with some ankle weights again as well. This is a fellow he does this for 45 minutes every dialysis. So sometimes it's simple, sometimes it's not. And this is in Mexico, which is a low-income country. In Singapore, when they build dialysis clinics, some of the dialysis clinics they've built there, they have gymnasiums right next to the dialysis clinic, which is a wonderful idea so people can exercise either before or after their dialysis clinic. Canada leads a lot of the dialysis exercise programs that are going on. They have these people called kinesiologists, which are like our physiotherapists or physical therapists or even exercise physiologists. And you can see people there with very cheap TheraBands and also a lady on a cycle as well during dialysis. These cycles are attached to their chairs, and so they're very light and very easy to do. Some people have gone and built exercise machines. This is quite a big clunky one from Wales, where this guy's doing quadricep pushes. This is one from Portugal, where you wheel this exercise machine around in front of a patient, and it's also got arm exercises. So potentially with your non-fistular arm, you can use that as well. But you don't need fancy machines. Colombia, again, is a low-income country. These are all people who are on dialysis, and this is on their non-dialysis day, and they do these group exercise sessions. You can see people with fistulas and with catheters there, and a bit of group fun, a bit of exercise, a bit of activity. And you don't even need that. You can just walk. And as much as they have lots of facilities in Italy and they do lots of really good exercise stuff, they also promote just walking, which is what we promote. In Canada, for those of you who know Winnipeg, it gets pretty cold and it snows a lot of the year. They have indoor sessions, and this is a group of kidney patients doing a session on a non-dialysis day. And it doesn't matter how debilitated you are, how strong you are, you can do it. This guy's on a wheelchair, this lady's on her frame, and they're still going round and round trying to do exercise. I like to show you this guy's wife. So this guy is on dialysis, he's got a transplant. His favourite hobby is pulling cars and trucks. Dennis was another one of our successful people in the States in our thing. He was pretty big guy, got diabetes, been on dialysis for quite a few years. You know, I wasn't moving around too much, but was really excited to do an exercise program. Lost about 10 kilos, and he's looking pretty good. I need to just talk a little bit about some of the things that we do in Australia. You can do a ABC drawing with toes. So you do, if you can actually, when you're on dialysis, you don't need any weights or anything. You can actually draw letters of the alphabet. You can do the whole alphabet, which gives you a really good core, thing. You can use very simple TheraBands. If you notice the guy on the right-hand side, he doesn't need any help. He's actually put the TheraBand tied it onto his belt, and is doing shoulder exercises, shoulder presses, and doing that all by himself. You can do simple bicep curls with TheraBands while you're on dialysis. This lady's just put a bicep, a TheraBand or elastic band around her. These cost about 40 cents because they come in a roll, and you can cut the roll up. She actually likes doing it, even though she may not look very happy there. You can do other exercises. You can do exercises, what we call seated row neutral exercise. So this is an exercise where you can exercise your shoulder as well, and lower leg exercises as well. Yeah, some of them you do need a bit of a hand by the nurses or the assistants, but certainly it's a great idea if you're sitting there for 3, 4, 5 hours to do at least something. And this is, I think, our last one that we're seeing. So another lower leg exercise where we can just do a calf exercise. And you don't need to be on dialysis. So this is another fellow, and he's doing bicep curls in the clinic, and also some core trunk rotations. Again, you don't need extremely expensive equipment. But if you do want to have expensive equipment, this is one of the machines that we made up in Adelaide, and you can see this woman, although it's a little bit clunky, and she's doing quadricep presses. You can do pretty zany things. This was a dialysis unit in Melbourne, and they got a Zumba class, so that's South American sort of Latin dancing, and they got some of the patients to do that. The music was a bit loud, and some people liked it, some people didn't, but it was worth a try. I just want to let you know that some of those exercises that you see, the videos are all online, and they're all available to anyone around the world. That manual on the left-hand side, the exercise on dialysis manual, is a manual that you can download from Kidney Health Australia. And there's all those different videos that you can see. If you go to kidney.org.au and go to the exercise area, you can see and download that instruction manual. You can also download these prompt cards that give you a sort of various examples of exercises you can do, which is to help people like Richard. And Richard, diabetic nephropathy, he's had above knee amputation. He was on dialysis, got a transplant, and then had to go back on dialysis again. He's you know, quite a typical dialysis patient that you see whose activity is getting less and less and less. This is the same guy after 4 months of rehabilitation with an exercise professional. Doesn't look like the same guy, but it is. Now, lots of people don't like formal exercise. They just want to have fun or just want to do stuff that they want to do. What we tried, I'm not sure, I don't think the sound's coming through, which is okay. But this is to give you an idea of some laughter therapists. I think it's a little bit clunky, so I won't go on too much about it. But what we do is we have a person who comes in who's a laughter therapist, and they actually go around and do laughter therapy in the dialysis clinics. People actually exercise and laugh at the same time. They know, their brain knows that it's actually forced laughter, but after a while, when everyone's laughing in the dialysis unit, it becomes natural laughter. And you can do all sorts of laughter examples. Swimming, teeth brushing. The great thing about laughter is actually like running a sort of a sprint or maybe something that goes for 15 to 30 minutes. And a bit about laughter is that you're actually using your breathing muscles really well, and particularly your diaphragm. If we just remind ourselves about what the lungs do, so there's this residual volume in our air that is there, so our lungs don't collapse. We have about a half a litre tidal volume, which is our normal breath. And when we do a forced expiratory volume, one of those, that shows how much reserve we've got. But what's really interesting is that when you do exercise or when you do laughter, you use this extra inspiratory reserve volume, which is what you do and you use when you're doing vigorous exercise, which is actually what laughter therapy is. And also it's about doing deep breathing and opening up the lungs. And part of the therapy that we do in many places is that we do deep breathing exercises. Often you can breathe in 7 seconds, hold it for 7, and then count 7 breathing out. And that gives you a nice relaxed feeling. And many of our patients who are on dialysis like doing these. They've actually forgotten how to do deep breathing exercises sometimes. So we've done laughter therapy in Australia. We've done laughter therapy in America. America is quite different. They have big, massive dialysis clinics of 48, 50 patients. And we have 3 or 4 shifts per time. And laughter therapy is one way that can help these patients get through the day, basically. I won't go through this whole video because I don't think the sound's working. We actually tested laughter therapy and did a randomized controlled trial in the States. And we had 10 centres randomized to laughter or control. 5 were in the laughter group and 5 were in the control group. So basically they did 30 minutes of laughter exercise and for over a period of 3 months. They did it once a week, or 8 weeks to 3 months. We measured anxiety, personal well-being, and also patient-reported outcomes with those measurement tools. Our main finding was that, not surprisingly, that laughter and group laughter reduced depressive symptoms in the hemodialysis laughter cohort. So we had 72 patients in the intervention and 80 in the control. And on that red graph shows you the control. Really, those patients, there were 17 patients who had depressive symptoms before the program started, and that really only went down to 16. In the laughter group, we had 11 that went down to about half. Laughter and exercise aren't the only things you can do, but they can sit alongside other programs such as meditation, music, art therapy, gaming, virtual reality, whatever you think might help your patients, because really, if they're doing something, it's better than nothing when it comes to activity. One of the great things with this laughter therapy stuff too is that it improves the whole vibe of the dialysis clinic. So it actually improves the feelings and the relationships and part of the community. And when you see your patients laugh and you laugh with them, it's just a beautiful thing. And we did other stuff. When you're in America, you have to brand all these things. So we had both in Spanish and in English. Today is Laughter Day. This is what it does for you. It can help open up your lungs. It can help movement, help mindfulness. We had some laughter lotion. So you put your laughter lotion on after dialysis, and that keeps your laughter in for the next dialysis. And if you don't think laughter therapy is in your part of the world, I'm telling you it is, because there are laughter clubs everywhere in the world. It took me a couple of seconds just to find the Kenya Laughter Club, African Laughter Club, Mauritius Laughter Club, and the Laughter Club in Rwanda. So, they're everywhere. Laughter is not just for Australians, Americans, and Africans. It's everywhere. Going back to any sorts of exercise, what we sort of developed was equivalent to KT/V. We're not big fans of KT/V in Australia. We believe that it's not just urea that causes problems. It's a lot of molecules, and it's fluid, and it's blood pressure, and it's everything. So I want to give you another formula that relates to the key elements of sustaining an exercise program. It's one thing to start it, but to sustain it. And that formula is greater than or equal to 2N plus U plus Q times CP plus EXP squared. And I'll just go through that in a minute. Greater than 2N is greater than 2 passionate nephrologists. We need nephrologists who are really passionate about exercise and activity and patients moving more. Often it's really good to have a university collaboration. So if we have a physical therapy school at a local university, a dialysis place, a dialysis clinic is a great place to have a clinical placement. So in some parts of Australia and the US and other parts of the world, we get our student exercise professionals to come in and to work in our dialysis clinics, which is fantastic for both the patients, and it also gives them some really great experience. It's great to have a quality metric that promotes physical activity. So we try to measure. Potentially you can use step watches for steps or other types of measures. We have clinical pathways. So when you start a patient off on dialysis, it's important to, start off maybe gradually, maybe once a week, twice a week, a small dialyzer, low blood flow rates, whatever your clinical pathway is. And, but to include also a discussion around, what sort of physical activity do you do right now? And one of the greatest, and that's why it's squared, is that if you have an exercise professional involved in your program, that costs money and it isn't available. But if you do have the opportunity, having an exercise professional is really important, because nurses, nephrologists, dietitians, we don't have the time, energy or skills to be involved in that. So if your formula is greater than 10, then you've got a sustainable exercise program going on. But like I said, it doesn't have to be like that. It can be any physical activity, because if you're just moving more, that's fantastic. So I'm coming to an end of this talk, and really this is what we talked a little bit about: physical deterioration, and the exercises that are being done around the world, a little bit about laughter. I'm sorry about the sound, didn't come through very well. But this is Jeff again, and if Jeff can do it, basically anyone can do it. Jeff was a fabulous guy, and he just really went from strength to strength, but needed some sort of extra motivation. I hope I'm doing this in a few years' time when I'm in an aged care session, and I hope I'm actually being able to be active when I'm young. This is a dialysis patient. She's still very active, and she's in her 80s. And maybe this is what we aim for, to try and get rid of the walkers and the frames when we're doing the exercise programs. I just want to give you a little bit of information that I'm on the other side of that frame, holding the frame up, so she's not really throwing it away. Thank you very much.
Thank you, Professor Bennett. That was quite an enlightening talk. It was good to see how we can integrate exercise, physical activity, and laughter for dialysis patients. I think the second last slide, that patient looked a bit more fitter than most of us. And it's quite nice to see a dialysis patient doing such. At this point, I just want to open the floor to any questions, any reactions that participants may have. Kindly feel free to type your questions in the chat box, or you can use the raise hand feature. Then I'll give you an opportunity to, give you an opportunity to talk openly and ask your question live. So in case you do have a question, kindly feel free. I think from the chat box, I can only see a lot of comments saying thank you for the presentation, quite informative, I think it was quite informative to all of us. Something else that I can also add is, I think looking at the link that you posted for GREX, I think it would be good for also us to be part of it, so that we can also sign up some of our patients, and also some of in our networks, just the dialysis units, so that we can also incorporate this to our patients. I think it was quite a good one, quite good learning points, and hopefully I think I took note of the link, so I'll be able to visit it, and we'll be able to share. And very interesting topic indeed, Professor. Just congratulatory messages, but no questions as yet.
I'm very happy to share the slides in a PDF format if you like, Yuri, and that'll have all the links as well. The videos won't come through, and I'm sorry about that sound, but that's what happens sometimes in Zoom.
Yeah, at least the videos played through, as much as we didn't hear much on the sound, but it was easy to follow. Yes. So quite good. I think if there are no questions, Carlos, might you have any question? Before, I don't want to close out anyone.
No. It was amazing. Thank you, Professor, because you share with us a lot of opportunities to understand how can the exercise can help exactly the patients, not exactly the movement, but the laughing and something like that, the therapy. For me, it's very interesting. I've never seen like this, So I appreciate your experience and you share with us.
And people need not to feel terrible that they don't do it, because we as nurses and nephrologists, our ultimate, our main aim is to have safe dialysis or a safe kidney care or prevent people going on dialysis. But if you can incorporate exercise somehow or activities somehow, it's not the be all and end all, but it's just something that I think we need to remember, and it affects their physical and mental health. It's hard because some of us aren't very fit either, and sometimes some of the exercises that we do show some of the nurses and nephrologists actually, oh yeah, I'll take that home and I'll do that exercise as well. So it's not just for the patients as well.
Yeah, just a quick question. When we are talking about exercise and the fistula program, how can the exercise can help to prevent problem with the fistula?
Yeah. So in our experience, and I can't speak for every country, in Australia we have probably 60% of people have fistulas, maybe 20% graft, and maybe 20% catheters. Of course, we have more catheters at the start. But we really don't care too much about the fistula, and there's really been no research to say that exercise is either bad or good for the fistula. There's been quite a few studies that tend to suggest, well, if we pump it with, if we do exercise on the fistula, it might help. And there's nothing to say that it doesn't help, but the studies aren't very good. But certainly we have patients who do weights with both arms, whether a fistula or not arm. They're not on dialysis, but they'll do team sports, they'll do triathlons. We have a colleague who often does some of these talks with me. She's done a marathon and she's on dialysis. So, that's an extreme, and we don't expect people to do that, and we don't encourage people, but we can't stop people either. Swimming is very good for people as long as you just take care of your fistula and you make sure it's clean afterwards and dry. There's no reason to suggest that most sports, apart from those very vigorous ones that might have sharp implements or, some things that clearly, and some people who do want to play vigorous sports like a taekwondo or a boxing, and they certainly make arm guards for their fistulas as well. So that's not out of the question. I think it's not an excuse to not do activity.
Okay, perfect. Thank you.
Thank you for that. There is just a question from the chat box. There's a participant by the name Elizabeth. I think she missed the bit on laughing therapy. So her question is, how does it benefit the patient? I think when you're discussing about the lungs and how laughing therapy helps with that.
So it doesn't hurt the lungs. It doesn't hurt anything else. In other chronic conditions, laughter therapy is like going for a 30-minute jog, a 30-minute run. You do laugh therapy for about 30 minutes, and it is quite tiring, and it does increase your heart rate. It increases so it's like an aerobic exercise, and you get quite exhausted at the end. What it does in dialysis units, though, and most people will do the laughter therapy when you have a laughter therapist there. Nurses, we're not generally very good at it, but you have someone who is a trained laughter therapist, and they're all around the world. I can tell you, they're everywhere in the world, because people like to laugh and people like to see other people laugh. And so what you find in the dialysis clinics is that those who do it, really it's about a group activity. They laugh together and they feel better together just because we've laughed together. So it's quite a mental health thing. And like I said, in that randomized controlled trial, which is the only laughter RCT ever done in the world in dialysis, we certainly lowered the potential for depression, which was a good thing. But I reckon importantly too, because we did some interviews with both patients and nurses afterwards, and they just felt it was a really good thing to do together. Some of the nurses hadn't seen patients laugh at all. I'm not saying that nurses and nephrologists don't want to make the dialysis place a nice place, because You know, some dialysis units are quite bleak, some are quite happy places as well because of the personalities. So there are lots of things that you do as nurses and nephrologists that make people happy and make people feel better. I'm not saying you don't do that already. You have jokes with patients, you have a good time. This laughter therapy is sort of an extended laughter therapy. And I'd suggest if you want to know more about it, you should Google laughter therapy dialysis, and you'll find those videos in YouTube or anywhere. They're out there, and you might see me or someone else doing laughter therapy in a dialysis clinic, and that's probably a good way of if you're interested in seeing more and seeing the results of what we do.
Thank you for the response, and I actually agree that because we have quite a number of patients that are immobile or are not able to walk, and or non-ambulatory patients. I think it's good to see that we can also do other types of exercises, even when seated. I think pulling on bands and so many other things. So there's no excuse not to do any physical activity. I think that's the take-home message today. And also the bit on the more we walk, the less likely we are to die. So I think that's a challenge to all of us. We need to walk more, we need to laugh more, and then we live longer. I think that's a really good one, Professor.
Yeah, that's great. You could have that as a big sign on all our dialysis units. Move more and laugh more.
Yes, definitely.
At the African Health Network.
Yes, definitely. I think once we do get the slides and we can also share the links around, we'll be able to explore more ways to integrate physical activity, exercise, and laughter. Yeah. I think we don't have any more questions. So on behalf of the Africa Healthcare Network and our panelists, I want to again convey my thanks to Professor Bennett for making time to take us through this interesting topic today. We have learned quite a lot, and hopefully we are going to also start practicing this and also just push the agenda of more laughter, more physical activity. As we say, it's bottom line is not just KT over V, but there's a lot. It needs to be holistic. We need to integrate more areas, not just achieving clearance, but activity, laughter, and also integrating diet and all that to make patients' lives better. So thank you for making time, and also thank you to the participants who took time from their busy schedule. I know it's the middle of the day, so mostly in Africa, so most guys are at work. We had around, I think, around 55 participants at some point, so that's quite a good number. And I hope we'll take the message home. And from here, again, this talk is going to be posted on our YouTube channel at Africa Healthcare Network. So for the people who probably missed this, we'll be able to catch it on later, and then we'll be able to learn together. But thank you, Professor, and have a good evening in Australia.
Thanks so much, Dr. Yuri. Thank you, everyone. Have a great day.